It's amazing how many times I have a patient come in with lower back pain and a bulging disc, many times with their MRI report in their hand. And they've been told by their MD, their physical therapist or chiropractor to do some specific exercises and stretches for their pain. But the stretches aren't helping. In many cases, the patient's pain keeps getting worse. You see, getting relief, many times in just a few hours or days from a bulging lumbar disc is often quite simple, but you have to know what to do, and more importantly, what not to do. In this video, I'm going to share with you exactly the stretches that make a bulging disc worse. I'll also help you understand why those exercises are so commonly prescribed and why you might actually feel better while you're doing them, even though overall they're taking you further away from healing. I'm also going to give you 3 positions that can bring you lower back pain relief. And lastly, I'm going to teach you 3 postural landmines and how to avoid them. Things that are really hidden irritants that can keep your lower back and lumbar discs in pain. I'm Dr. Brant Pedersen, and before we jump in, 2 important things. 1, I'm really big on sharing the backstory or the why of things, not just the what and the how. But if you just want to jump right to the section of this video that feels like it's best for you, I put chapters down below in the description so you can jump right to that spot. Number 2, this video is going to cover what not to do if you have a lumbar disc bulge, and I'm going to give you some pain relief strategies and postural help. Those are important things to get pain relief and allow your disc to heal. But there's another video that I made that I'll link to at the end of this video that was created specifically to teach you the exercises that you can do to help promote healing of many lumbar disc issues. It's my recommendation that if you're suffering from lumbar disc pain, that you check out both of these videos. Now let's jump in. So exercises that are commonly taught to low back and disc pain sufferers are things like the double knee to chest stretch or the single knee to chest stretch, or variations of stretching the hamstrings either seated with a band or standing. Maybe a figure 4 piriformis stretch, child's pose. Are these sounding familiar? The reason they are taught and sometimes feel like they're helping in the moment is because most of the time a person with a lumbar disc bulge will concurrently have really tight hamstrings and low back muscles. And these flexion type stretches of the hamstrings and lower back muscles seem like the right thing to do for a tight muscle, right? Haven't we all been taught all our lives to stretch tight muscles? The problem is that underlying the tightness in those muscles is the reason that the muscles are tight in the first place. And understanding that why will unlock for you the folly in doing these flexion type stretches for lumbar disc and low back pain. Are you ready to peel back the curtain and develop an understanding and start healing? Awesome, because I love teaching this. The discs in your spine are built of an outer layer that's called the annulus fibrosus. It is a layer of strong connective tissue. You can think of these layers like the rings of a tree or the plies on a tire. These layers give the outer portion of the disc strength, and the inner portion of the disc is made up of a jelly-like substance called the nucleus pulposus. And this jelly gives the flexibility and mobility to your disc and therefore your spine. The human intervertebral discs, the discs between the vertebrae, are incredibly tough and resilient, and they're made to withstand significant loading. An example of this is weightlifting. The current world record for a deadlift is 1,105 pounds, set in 2020 by Thor Bjornsson. It's just amazing, over 1,000 pounds. Here's the thing, discs don't get stronger by loading them. Unlike your muscles and your tendons and your bones, which all get stronger as you use and load them, the discs of your spine don't lay down extra layers or gain strength by using them. So that means you and Thor started out with roughly the same lumbar disc structure and strength. I say this to dispel the myth that you've got bad discs or your discs are weak. What I see most commonly in my clinic is not bad discs, but people that don't know how to use their back properly and repeatedly injure their lumbar discs hour after hour each day without knowing it. Until one day, their body 100% lets them know it by creating intense back pain, muscle spasms, and many times symptoms down their legs. So how can Thor lift 1,100 pounds and someone else can't bend over to unload the dishwasher without pain? Let's talk about what creates 95% of all lumbar disc bulges. Remember that jelly that's inside the disc? Pretend this inflatable cushion is the disc. And when load is placed directly through the disc like this, the jelly pushes equally into the strong layers of the annulus fibrosus. But when a person bends their spine into flexion, that means rounding it forward like this, then the load placed on the disc looks like this. And you can see that all the pressure now gets pushed towards the back of the disc. The thing is, 99% of all disc bulges happen in the back of the disc, not on the sides, and not on the front of the disc. That is because of repeatedly loading the spine in flexion. And unfortunately, your spinal cord and your spinal nerves that go down into your legs, they all pass right by the back of the disc. That repeated flexion of the disc and pressuring the jelly towards the back of the disc leads to tears through those annular fibers. They're called annular tears. You can see them as the red lines in the outside of this model. And the layers of the annulus have a certain number of bending or pressure cycles that they can perform before they fatigue and the jelly is allowed to leak out. That fatigue is just like bending a credit card repeatedly over and over. It will eventually break in two, even though it's made of tough plastic. When the tears in the annulus are getting through a significant portion of the disc, you get a disc that starts to bulge. A more severe disc bulge is called a disc protrusion. And once the tear extends all the way through the annulus fibrosis, you get a disc extrusion, meaning the jelly substance is now leaked through the disc. This creates intense localized inflammation in that area, and continuing to repeatedly go into flexion can even cause that jelly-like disc material to become what's called sequestered, or become a free fragment of that jelly that's now floating around separate from the disc itself. So hopefully now you have a better understanding of how lumbar disc bulges happen by repeatedly going into lumbar flexion. And you can see how exercises and stretches that are lumbar flexion based, meaning to some degree or another, they round your lower back like these, just irritate the tears in the annulus and pressure the jelly-like substance to want to bulge out of the disc. Luckily, the body has intelligence to it. And because it can sense that repeated lumbar flexion causes the disc to get harmed, the body tightens down. Sometimes tightens down to the point of muscle spasms, completely locking down the muscles in the lower back. It is doing this to try to stop you from going into more lumbar flexion and hurting your discs more. So you can see why trying to stretch those tight muscles that are protecting you is leading you farther away from healing, even though in the moment, it might feel like stretching the tight muscle brings you temporary relief. So what are some things that can be done when someone is having significant low back pain and bulging disc pain? Before we begin, I want to say that it's always paramount to listen to your body. Like I've said, our body has a built-in wisdom to it, and pain is a signal that things aren't right. So if anything I'm teaching here brings you more pain instead of less, it is either that you have something else going on, so work with your doc, always work with your doc, or you're not ready for that step, or you're doing something incorrectly. Since YouTube is a one-way medium and I can't see you, make sure to work with your healthcare professionals closely. They can catch red flags and other things that might be causing your pain. The key is, don't give up. If you're not getting results from your doctors, ask friends and family for a referral to someone they like. Look online for reviews. If you happen to be in Northern California, I'd be happy to help you. But most important, keep going and don't give up. I believe in you. So the first pain relieving position we're going to talk about is legs up on a chair or a couch. And this helps to calm down the muscles in the spine, allows your spine to go into spinal neutral, and helps to decompress those discs, take the pressure off of them. So what we're going to do is come up, put our legs up on the couch or the chair. And what you want to do is slide your buttocks in as close as you can to the furniture. We want ideally this at a 90-degree angle. So we don't want your legs up like this if you can. And then a really important part that people many times forget is you want to have something, a towel or a pillow, underneath your neck to relieve the tension. What we're looking for is to get all the tension out of our whole spine. A lot of times people hold a lot of tension, and if we leave the neck flat like this, it'll build up too much tension. So as much as you need to get it so that your neck and upper back feel relaxed, you want to put that much in there. Then I like to put my hands out at 45 degrees, palms facing up, and then this is the really hard part, you're just going to relax. So I'll have people hang out in this position for 5, 10, 15 minutes. Sometimes my patients will fall asleep in this position. They say that it brings them so much relief. So we're just going to hang out here, breathing and just letting everything relax. The next pain relieving position is called the modified Cobra. And this is exciting because this is actually where we start to help the disc heal by getting that disc material pushing back away from where it bulges out or where it might be leaking out. Pretty simple to do, and I like to do it on the floor instead of a bed because sometimes the bed puts us into too much extension. What we're gonna do first is you can just do it resting down like this with your head on your hands or your head off to the side, and we don't have to go into too much extension. Once you feel like you can, we'll come up here into a modified Cobra position where we're gonna be up on our elbows. And what's really important here is that you just let your low back and buttocks muscles relax. Sometimes people really hold tension, so you don't wanna do that. Then you wanna make sure that your hips are down on the ground. You don't wanna have those up. So our hips down on the floor, and then from here, just gonna hang out. I'll have my patients read a book, be on their phone, watching a video.
that kind of thing. Now this position, it should help symptoms that might be going down your leg to come back up into more of your buttocks instead of traveling further down. If they travel further down, that's something called peripheralization, and this isn't an exercise for you at this point. But we want to see that the intensity or that the location of where you're having symptoms go down your leg, that they're tracing back upwards or the intensity is getting less. If someone's got central canal stenosis, this is probably going to be an exercise that they won't tolerate well, and I would have them wait to talk to their doc before doing this exercise. So I'll have people hang out in this position 5-10 minutes, reading something. They can do it multiple times per day, and this should help to bring relief and start to help the disc support the healing of a lumbar disc bulge.
The last relief position that I want to talk about is similar to legs up on a chair, but it allows you to take that relief into a bed when you're sleeping. What we're going to do, build up some pillows. We can use more or less to get you a proper angle that feels like it is good. And then as you get better, you'll be able to slowly take away those pillows. What we're doing here is reducing the tension and the pressure on the discs by getting in this position. I want to say that lying on your back is not the only position that you can be in when you have a disc issue. Sometimes people want to lie on their side, and sometimes people note an improvement in their pain when they take and put a pillow between their knees to help keep their thighs level when they're lying on their side. So we've talked about 3 pain relieving positions for a bulging disc. Now let's talk about a few postural and movement pitfalls that are very common and must be corrected to get lasting lower back and disc pain relief. The central theme of all of what I'm about to teach is practical ways to keep your lumbar spine in neutral versus the flexed posture, because we all know now what going into lumbar flexion does to a bulging lumbar disc. This first lesson is in transitioning positions. And a lot of times someone with low back or lumbar disc pain will have a lot of pain going from seated to standing. So we're gonna help you understand how to better get in and out of a chair. To do that, first thing we're gonna do is slide to the edge of the chair, and then keeping our chest up, we're gonna hinge from our hips, which means that we're keeping our back flat or in neutral spine instead of rounding it as we go to get up. So we're going to come to the edge of the chair, keeping our spine in neutral. We're gonna practice a few of those hip hinges like this, just bending from our hips. Then what we're gonna do is pull our heels in just so that the heels get a little unweighted. And what we're gonna do, keeping the chest up, hinging from the hips, we're gonna add a little momentum to that hip hinge, like this. And voila, we are up. Now, when we go to sit down, similar thing, I'm gonna back up to the chair so that my calves are about touching it. I'm gonna have my feet about hips width apart, a little V'd out. And then what I'm gonna do from here is again, hinge at my hips, keep my chest up, and slowly come down until I get to the chair. I don't want to take and drop that last little bit. This becomes, the getting in and out of a chair becomes you practicing a good squat in a controlled fashion. If you're a little unsteady when you first try this, have someone help you. But what we're gonna do is slowly come back and sit down like that. Again, hinging from our hips, keeping our spine in neutral. If you will do this on a regular basis, every time you get in and out of a chair, you're gonna be making your glute max muscle, the most important muscle in your body, you're gonna be making it stronger. Before I give you this next tip, I just wanna share that my love language is words of encouragement, and it means the world to me when my viewers write a comment or give the video a thumbs up. So thank you. So the next postural pitfall that can get you in trouble is most people when they're sitting, and most people sit most of their day, most people are rounding their lower back. And we've talked about how that rounding is pushing that jelly material back towards the disc bulge, making the disc bulge worse. And sitting properly is one of my passions. I traveled to Paris. I studied for 3 weeks with one of the leading experts in the world on teaching people good posture. I've got videos about that, and I'll put links to those down below. But I want to give you something that you can do right away without having to learn a lot of stuff that'll help you to sit better. The trick that I found is I use a lumbar cushion like this. I like this one because it's breathable, it's lightweight, it's pretty inexpensive. Have one in your car, in your house, and it travels well. I'll put a link down below in the description notes for where I got this one. But the trick here, if you will take your buttocks and slide them all the way back against the back of the chair, then a lumbar support cushion like this, and this one's adjustable, will allow your spine to stay in a neutral position. If your buttocks is against the back of the chair, it will make it almost impossible for you to have a flexed lower back position. Now, the reason I say if your back's against the chair, You can sit with your butt away from the chair and still have a rounded back position with a lumbar cushion. So make sure your butt goes all the way back against the back of the chair and that the cushion is there in the lower part of your back to put you almost into a little extension, maybe just spinal neutral, like that. The third tip I have is to help you with activities of daily living. Things like working around the house, picking stuff up. And it has to do with bending from your hips when you go to pick up something instead of bending from your low back. Remember, we don't want to go into low back flexion. An easy way to know if you're bending from your hips instead of from your low back is to look at your clothing. If your bends, if your creases are coming from your hip joint, you're bending from your hip. If the creases and folds in your clothing are coming from your shirt, then you're bending opposite your belly, which is in your low back. So we want to see the creases happening in our pants instead of our shirt. And then an exercise that I give my patients, you can use a stick, a broomstick, something like that. So I'll have them hold the stick against their low back and upper back here in between their shoulders. And what I have them do, you'll notice there's a little space here. What I have them do is take and bend over. The stick should not come off their upper back and it should stay down low. And ideally you still have a little space here where the stick's not touching your hand. So you can bend over quite a ways. I could pick up a lot of things like if I was gonna get something out of the dishwasher there. All of that is coming just from my hips and hamstring flexibility. As you do this, your hamstrings will get more flexible. But this is what I'll see happens to a lot of people. They'll put the stick like this, they'll go to bend over and it does this. See how it came off my upper back? They're bending from their back and not from their hips. So this stick allows them to have some external feedback of whether they're bending properly or whether they're bending incorrectly. So that's a way that you can practice this. I can't stress this enough, that if you are dealing with a lumbar disc bulge, that you need to 100% stop forward bending from your spine. That's things like brushing your teeth and loading the dishwasher, and putting on your shoes. It might feel awkward at first to bend solely from your hips, and it's gonna make things take longer and require more focus at first. But if you repeatedly flex forward from your lower back, it becomes really hard to get lasting pain relief and healing in your lumbar discs. In helping people with lumbar disc bulges for the past 20 years, it is humbling and inspiring to see how when people will learn what's causing their lumbar disc to bulge and strategies to stop making it worse, that the body has the ability to heal most disc issues without injections or surgery. In this video right here, I help you understand a bit more about the different types of disc issues and 3 exercises that you can use to speed up disc healing and pain relief.